And welcome to your personal care aid training. My name is Tashana McElveen and I'm your RN educator for today. This training is presented by Prince Charles Home Healthcare Agency. Again, we would like to welcome you. At the end of this training, you will receive a certificate of completion stating that you have completed a 40-hour training to become a personal care aide presented by myself, Tashana McElveen, through Prince Charles Home Healthcare Agency. To be a candidate for this class, you must be at least 18 years of age, able to read and write in English to the degree necessary to perform the job, and then also you must be able to complete the task required. The majority of the clients that we service here at Prince Charles Home Healthcare Agency would be considered our elderly population. We do service children, teens, and young adults, middle-aged adults, but the majority of our clients are considered elderly. Physical and biological aspects of aging. As we begin to age, there are some cardiovascular changes that take place. Number one, the heart rate decreases, causing a slower pulse and less effective or less efficient blood circulation. Blood vessels lose elasticity and develop calcium deposits, resulting in a narrowing of the blood vessels, which causes increased blood pressure, which is C, an increase in blood pressure because of the changes of the walls to the blood vessels. It takes longer for the heart rate to return to normal after exercise, and veins become large, causing blood vessels near the surface of the skin to become more prominent, also known as varicose veins. Some of the cardiovascular changes that take place in our elderly is the buildup of plaque. If you look to the far right of your screen, you will see how the artery has plaque buildup, which will decrease the blood flow. And the image right next to that has a normal artery with good blood flow. Respiratory changes occur because the lung capacity decreases because of the muscular rigidity in the lungs. Cough becomes less effective, which allows the pooling of secretions and fluid in the lungs, placing the client at risk for infection, for diagnosis such as pneumonia. Shortness of breath may occur on exertion, and there's a less effective gas exchange that takes place in the lungs. This here is an image of the right and left lung, which shows the lobes upper, middle, and lower for each side. It also includes the bronchi and the trachea in this image. Lung expansion is important for effective breathing patterns. There are urinary system changes that take place also. The bladder's capacity decreases, which increases the frequency of urination, meaning the bladder is unable to hold the same amount of urine as in the past. Kidney function increases at rest, causing the elderly to get up to urinate during the night. Bladder muscles weaken, which causes leakage of urine or inadequate emptying of the bladder. The prostate gland becomes enlarged, which increases the frequency of urination also, causes dribbling, urinary retention, and urinary obstruction. This image includes the picture of a normal prostate. In the event this prostate becomes enlarged, it presses against the bladder, and in the event it presses against the bladder, it will cause urinary dribbling, urinary retention, obstruction, and it will increase the urinary frequency of the male. I have included an image of the urinary system that shows the anatomy of the kidney, ureters, and the bladder for your reference. Let's discuss digestive system changes. Saliva production in the mouth decreases, interfering with digestion of starch. Taste buds on the tongue decrease, beginning with sweet and salt. The gag reflex in the throat is less effective, increasing the risk of choking. Movement of food into the stomach through the esophagus is slower. The stomach takes longer to empty into the small intestines, so food remains there longer, which gives them a feeling of being full. Fewer digestive enzymes are present in the stomach, causing indigestion and slower absorption of fat. Nervous system changes. More time is needed for tasks involving speed, balance, coordination, and fine motor skills, such as those involving the fingers. Problems develop with balance and coordination as a result of deterioration of nerve terminals that provide information to the brain on movement and positioning of the body. The lens in the eye become less flexible, causing visual changes. Decreased secretions of fluid in the eye causes dryness and itching. Nerves and blood supply to the ears decrease, causing a difficulty in hearing. There is a decrease in the ability to feel pressure and temperature, resulting in higher potential for injury like burns. Blood flow to the brain decreases, which may result in mental confusion or memory loss. Musculoskeletal changes. A decrease in strength, endurance, muscle tone, and reaction time is caused by loss of elasticity of muscles and decrease in muscle mass. Bones lose minerals, become brittle, and break more easily. The spine is less stable, less flexible, and more easily injured. Posture may become poor because of weakness in back muscles. Degenerative changes or deterioration occur in the joints, resulting in limited movement, stiffness, and pain. Musculoskeletal changes continued. The elderly lady on the left has a diagnosis of something called kyphosis. Kyphosis is a curvature of the spine, which leaves the elderly member or patient in a position that you see here. However, if you look to your right, you will see a normal spine where the individual is upright and the spine is straight. It has a natural curvature to it that is normal. This is what happens when those musculoskeletal changes occur in our elderly population. Skin changes, integumentary changes. The skin becomes thin and becomes less elastic, wrinkles appear, and the skin becomes irritated and breaks more easily. Blood vessels that nourish the skin become more fragile and break more easily, resulting in bruising, senile purpura, and skin tears. Blood flow in vessels that nourish the skin is reduced, resulting in slower healing. Oil glands that supply the skin secrete less, causing drying of the skin and itching. Perspiration decreases and the body's ability to regulate temperature is impaired. Subcutaneous fat diminishes. Blood supply to the feet and legs is diminished. Fingernails and toenails grow slower and nails become more brittle. Hair thins and turns gray. That's why it's important for caregivers not to wear long nails because the skin is so fragile and so thin. It's also important not to grab on the clients because they can bruise so easily. So using proper technique, having appropriate nail lengths will help protect your clients and yourself. Endocrine system changes. Blood sugar levels increases because of the delayed release of insulin, a hormone that regulates sugar use in the body. The amount of calories needed for the body to function normally decreases because of lower metabolism rates or slower body functioning. Reproductive system changes. Hormone production decreases, causing decreased size of testes and a lower sperm count. However, we do see some elderly men still producing and having children later in life. More time is needed for an erection to occur. Fewer female hormones are produced. The vagina becomes shorter and narrower. Vaginal secretions decrease, and the breast tissue decreases, and the muscles supporting the breast weaken, which may cause the breast to sag. Psychological aspects of aging. There are many factors to contribute to the psychological aspects of aging. These include the loss of income, the loss of a home, loss of their independence, loss of spouse, illness or disease, loss of a sense of security, and a loss of trust. There are also numerous behaviors due to these psychological changes, these psychological factors that include poor appetite, depression, anger, and insomnia. A lot of times when our elderly, the family have to make tough decisions to place their loved ones in a nursing home, and they may have to sell their home, and these things can cause our clients to have these symptoms that include loss of appetite, depression, anger, and they also have these feelings of a loss of trust. They don't know who to trust because they really want to remain in their homes. And a lot of times when you go out and do these assessments, they are so afraid of being placed in a nursing home. So some of the psychological aspects of aging contribute to these factors that's included in number 2. Let's discuss some of the physical and emotional needs of our elderly. These needs initially any basic human needs, which include physiological needs: water, food, sleep, rest, physical activity, elimination, and oxygen. We all need that as human beings. But we also need to feel safe and protected. We need to feel that we have our personal relationships. We need to feel security on our jobs and our financing. We need to feel loved and feel belong, as if we belong. We have to show the recipient that we care and accept him or her regardless of their disability, condition, appearance, or behavior. A lot of times we're the only family that that client may have. So it's important for us to be there. It's important for us to be consistent. And again, that helps with those psychological changes we were just discussing. When they have someone that's there consistently, studies have proven that our clients eat better, they're no longer depressed. When they get out more or when they have that companionship, it gives them a better quality of life. It gives them something to look better for. It's important for our clients to also feel self-esteem and feel respected. It's important for them to not feel threatened when they react with anger. When our clients react with anger, the best thing we can do is just step away and say, Mr. So-and-so or Mrs. So-and-so, I'm going to give you a little space. I'm going to step outside just for a second. We're going to pause and we're going to try it again a little later. As a personal care aide, you may find yourself involved in a verbally abusive situation, a combative situation, or an emergency situation. If you're ever in a verbally abusive situation, please remove yourself. Call the office and allow us to handle it from there. We always want you to feel comfortable and safe in any environment that you're in. If you're in a combative situation with a client, just try to make sure there's nothing around that can harm the client. Remove yourself from the situation and contact 911 and then call the office and notify the office of the situation. If there's a situation, again, contact 911 first and then contact the office. However, if you're ever in an environment where you feel threatened, you feel there is some type of abuse, not only just verbal abuse, physical abuse, sexual harassment, inappropriate comments, always remove yourself from that situation and report it to the office immediately. Our clients or the elderly may suffer from physical disabilities and or handicaps. Some may suffer from rheumatoid arthritis, which is a severely crippling and painful disease. You have to be very careful when caring for these clients because it's very painful. So you must be very gentle when you're moving, turning, bathing, and dressing the recipient. We have clients that have suffered from strokes or CVAs, and this may result in slurred speech, difficulty swallowing, paralysis on one extremity, paralysis on one side of the body, or total paralysis. So the PCA needs to ensure the skills of transferring and, if necessary, how to use a lift. Clients may suffer from heart trouble or cardiac issues or cardiac disorders, and they may suffer from chest pain. The recipient may show signs of chest pain on exertion, which include other symptoms like sweating, nausea, pain in the left jaw, shoulder blade, and may become short of breath easily. In those situations, you need to call 911 and contact the RN supervisor or the office to report the details. Number 4 is Alzheimer's. Alzheimer's can manifest in a variety of ways. Many people with Alzheimer's may wander off and therefore will need to be monitored at all times. We call these supervision cases. In a supervision case, the patient can never be left alone. Therefore, when you come, someone is in the home, and when you leave, someone is in the home. So it's very important to know that in a supervision case, they can never be left alone, and that would be with your Alzheimer's or dementia patients. Now, these patients also present a danger to themselves by attempting to perform a task and forgetting what they started to do. One may attempt to cook and may leave the stove on. Recipients with Alzheimer's may also become combative at times and not be aware of their actions. That's why I say it's important to try to make sure the environment is safe for the combative patient, especially when dealing with an Alzheimer's or dementia patient. You just want to make sure that they're safe, but you also want to make sure that you're safe as well. So please contact the office in those types of situations. Sometimes you may just have to leave them in the home and you go outside to your car and give us a call until we can contact a family member or the appropriate authorities to come to the home. Universal precautions. With universal precautions, I'm just going to give you a simple definition, and that's where you're protecting yourself and the client is universal. You want to make sure you're protecting yourself from the client's blood and body fluids, and you want to make sure you're protecting the client from any of your blood and body fluids. So it's always important to wash your hands before, during, and after any care that's provided. You want to come in contact possibly with any blood or body fluids. That includes even when you're taking your clients' clothes to the laundry. A lot of times our clients like to pack tissue in their clothes and pockets, and you will need to clean those things out before you start laundry. So you want to wear gloves when you're doing laundry, when you're changing the bed, and you want to make sure that you're carrying the linen furthest away from your body when transporting it to the laundry room. You want to make sure that you're cleaning and sanitizing areas, and you want to make sure that you're placing liners in the trash cans and the small trash bins. Again, you want to protect yourself and you want to protect your client. It's important to prevent skin breakdown for your client. While giving your client a bath or assisting with grooming, you can easily inspect the client's skin, looking for red marks, bruising, potential bed sores, or skin tears. In the event you notice any changes in the client's skin, it's important to report these changes to your RN supervisor. You should monitor all bony prominences because they are areas that can easily break down and result in a decubitus or a bed sore. Other areas are also susceptible to skin breakdown as well and must be monitored during care. The most effective way to prevent the skin from breaking down is to change the recipient's position a minimum of every 2 hours. Any part of the body that touches the mattresses or mattress is at risk for skin breakdown. These parts may include the following: hips, heels, elbows, buttocks, ears, knees, ankles, and the head. Here you have an image with the most common pressure area sites. That's the head, shoulders, sacrum, buttocks, and heels. Again, ankles, hips, ears, all of those are included. Any area that can touch the mattress. Again, it's important to make sure you're repositioning your patient every 2 hours at minimum to prevent pressure areas or bed sores within your client. It's also good to add cushions between the knees, under the heels, behind the back to help the client stay on one side or the other side. So providing padding and cushion and also turning your clients a minimum of every 2 hours will help prevent skin breakdown. There are some symptoms that you may notice when the skin starts to break down. You may see some redness. You may even see blisters. The client's skin may be itchy, warm to touch, and dark discoloration. Next, I will show you the different stages that the skin may be going through if you notice some of these breakdown symptoms. Here is an image of the stages of pressure sores. If you notice in number 1, you will see that the skin is red. The epidermis is just red. Number 2, and you may notice some itching in number 1 also, red and itching. Number 2, the skin is red and is actually broken. It's broken through the epidermis and the dermis. Stage 3, the skin is penetrated down, the bed sore has penetrated down to the subcutaneous fat, that layer there. It's right over top of it, and the blood supply is affected there also. And stage 4, you can see where that decubitus has opened up down to the bone, and that is a stage 4. Based on the information that was just given to you, can you guess what stage this is? Would you have said stage 2 if it wasn't at the top of the screen? This image here shows necrotic tissue, and that's tissue that is considered dead, unhealthy, and typically debridement has to occur here where the wound has to be cleansed. All the black tissue or dark tissue has to be removed to get down to the red, beefy tissue that will promote wound healing. It will not heal in this state here with the dark tissue there. Vital signs. Let's talk about vital signs. The key components to your vital signs would be your blood pressure, temperature, respirations, pulse, and in some cases, O2 saturations. Normal blood pressure for testing purposes and for the PCA class today would be 120 to 140 over 70 to 80. A normal temperature would be 98.6. And you can obtain temperatures orally, axillary, tympanic, or rectally. However, for personal care aids, we do not obtain any rectal temperatures. Respirations. Respirations are 18 to 20 breaths per minute. A normal pulse is 60 to 80 beats per minute. You can obtain a pulse listening over the apex of the heart, or you can obtain it radially with 2 fingers on the wrist straight down from the thumb. As a personal care aide, you do have some limitations, and we're going to discuss those now. A personal care aide cannot perform any skilled nursing tasks, such as changing a catheter, giving an injection, changing a sterile dressing, performing any type of tube feeding, suctioning, cutting fingernails, and toenails. Most of the time, we're asked if caregivers can assist with AccuChecks. The caregiver can assist, but they cannot physically um, stick your finger. You can't physically stick the finger of the client. They have to prick their own finger, but you can assist them with gathering the supplies, making sure their hand is steady, but they must prick their own finger. Also, in the event your client may have a dressing secondary to a bed sore or a wound, you are not allowed to put a sterile dressing over it, but you can put a clean, dry dressing over it with no medications or anything of that nature. And you can just secure it until a family member or the nurse can come redress the area. You can apply a dry dressing. The PCA may not perform any other care for a person residing in the same home as your client. As far as limitations, when you're in the home, you're only supposed to provide care to the Medicaid recipient that we assign you to. A lot of times there are other family members in the home, but you're only responsible for the client we assign you to. As a personal caregiver, it's important to help maintain the home. Home management is very important while you're in your client's home. The importance of maintaining a clean environment will promote health and prevent injury and prevent the spread of disease. Housekeeping duties are for the living areas of the recipient only. Oftentimes, when you go into a home, there may be other family members that reside there, and they will want you to wash their dishes, clean their bathroom, wash their clothes, but you're only responsible for your client. So you're responsible for your client's bedroom, any areas that the client sat in, like a living room or a den, the dishes that you use to prepare breakfast or lunch or a snack, and tidy the kitchen from where you used it to make your client's meals. You're also responsible for tidying the bathroom after you give your client a bath, meaning getting up their clothes and putting back their belongings, their personal hygiene items. And if it was a shower, just kind of spraying down the shower from the client after they had their care that morning. The RN will develop a schedule of all the tasks to be completed after having a discussion with the client, and you will receive a form called a plan of care. The plan of care will give you the directions on the tasks on what needs to be completed while you're in the client's home and the time you're supposed to be in the client's home. While you're in the client's home, it's important to try to prevent any accidents and promote as much safety as possible. But there are some common accidents that occur, and that would include falls, burns, and medication errors. How can we prevent these accidents from occurring? We should and we must wipe up spills immediately. We could use pre-filled medication boxes, remove area rugs, always assisting the recipient when needed, making sure the home is not cluttered. Make sure there are no extension cords or oxygen cords that's running across the path of the recipient. And always make sure the client is wearing some type of non-skid shoe. And then you want to make sure there's adequate ventilation and space when clients are using space heaters in the home. These space heaters have a tendency to lead to burns. In the event there is an accident or an injury, when dealing with a fall, the PCA should never move the recipient until the recipient has been evaluated. A lot of times, recipients do not want to go to the hospital, but you can still call the local fire department to come assess your client to be sure they are not injured, they don't have any fractures, and also to assist with getting them back to the chair or to the bed in a safe way, safe manner. The PCA should never clean a wound without anything other than soap and water. The PCA should always call the RN supervisor immediately about an accident or an injury or call 911 if needed. Food and nutrition. Proper nutrition promotes health and wound healing. Some general concepts to remember when planning meals for your client. You want to make sure that the meal has some nutritional value. You want to make sure to consider the cultural and ethnic food patterns, their individual likes and dislikes, their budgetary limitations, and any special considerations of a normal diet. Special considerations in preparing a special diet. Also, food purchasing and preparation, how you're going to get the food, how you're going to prepare it, food storage and sanitation. Oftentimes, patients, they don't want you to buy food in bulk because they live in small quarters and they don't have anywhere to store it, or it may go bad. So just make sure to listen to your client and their needs as far as food storage, food purchasing, and their budgetary limitations. As a personal care aide, you are required to document all of the tasks that are completed. We are now currently using a system called ERSP, and this is an electronic visit verification system that captures your geolocation when you arrive at your client's home and when you leave your client's homes. Medicaid aid records are to be completed at the time the service is provided to the recipient through the electronic verification system. You will be required to clock in and out through telephony or the ERSP app. You must obtain your client's signature to confirm that all tasks were completed. You must sign your name, complete all the required activities, and answer the care note questions to successfully complete your shift. The goals of personal care are simply to promote self-care and independence. We want to assure the client's safety and comfort while all the time maintaining dignity and their self-respect and maintaining stability. At this time, you will begin watching videos on vital signs, fire safety, transfers, bathing, grooming, dressing, toileting, ambulation, hand washing, making and changing the bed, and proper gloving techniques. So I would like to thank you as we complete this part of our education program. Again, my name is Tashana McElveen, and I thank you for attending this personal care aid class here at Prince Charles Home Health Care Agency.